It's 2:10 p.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We're breaking into our regular programming for a live briefing from the South Korean health authorities on the coronavirus outbreak. The briefing's just about to start. Listen in.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 27th. As of today midnight, we have 405 new local infections and 10 new imported cases. The total caseload now stands at 89,321. And a total of 72,645 tests have been conducted yesterday, and at the makeshift testing centers in the metropolitan area, we carried out about 35,496 cases, out of which we had 82 confirmed cases. And we have 453 more people being discharged, while 7,393 people still remain in quarantine. And there are two less people with critical or severe conditions, with the number standing at 142, and we had 10 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some major updates of our domestic infections by region. And in the capital area, we have today 323 cases, which is about 79% of the today's total cases. And here are some details by cases. And in Seoul's Gurogu District Medical Hospital, we have 12 cases being confirmed. And also we had 8 additional cases being confirmed at the University Hospital in Yongsan-gu District, raising the total to 259. And also in Incheon as well, we also have 28 accumulated cases at a hospital. And in Gyeonggi-do Province, we have also in Yangju City, we have the manufacturing facility. We have 14 cases and also 12 cases at another manufacturing facility in Gyeonggi-do Province. And in Gyeonggi-do Province, Pyeongtaek City, in relation to a recycling center, we have 13 cases being confirmed to date. And moreover, in relation to the Namyangju City, in relation to the welfare center, and together with the Pocheon City's cases, we also have additional of 13 cases being confirmed to date. And also Chungcheong area, we also have many office buildings or workplaces. And in relation to the boiler factory in Asan City, we have 6 additional cases, raising the total to 198. And in Honam area, as follows: in Gwangju Seogu District, we have the call center. We have a total of 51 cases being confirmed. And Jeollabuk-do Province, Jeonju City, in relation to a fitness center, we have confirmed 21 additional cases, and a total of 35 people have been confirmed to date. And in Gyeongbuk region, Uiseong-gun County, we have the family gathering, 6 people being confirmed. And also Uiseong-gun County, we have the family gathering in a hot spring. A total of 101 cases have been confirmed to date. Recently, we are also seeing major cluster infections concentrated on the cluster infections of migrant workers as well as the workplaces. And here are some details of our response measures. During the past 2 weeks, we have seen a total of 71 cluster infections, and out of them, we have 19 cases being clustered at industrial and workplaces. A majority of them were clustered in the metropolitan area, 9 to be exact, and Chungcheong area, 8. And as for the foreigners, we also have seen here in the Korea, we have seen 6.6%, which hovers around 1,740. And during the past 1 month, we have seen a steady increase of these proportions. And by region, looking at their proportion, we have 47.1% in the Gyeonggi-do area. And by industries, we also see in Gyeonggi-do Province, Namyangju City, in relation to the plastic factory, we have 5 clusters related to the manufacturing facilities, and they also include the food processing as well as sales operations as well. And to this end, we will also continue to exert our full efforts and cooperate with our other ministries and local governments to contain the further spread of these virus. And we have come up with tailored and customized response measures. First of all, we will be carrying out massive testings for these people, and second, we will also translate these protocols into other languages so that they would have more access to these testing sites as well as these antivirus protocols. And also, we will provide anonymous testing so that we will be able to have more people tested. And as for the R&D aspects, first of all, the remdesivir drug, we have administered a total of the drug to a total of 4,800 people at 121 hospitals here in South Korea. And the Rekinora antibody drug, we also have administered the drug to about 190 people here in South Korea. And as for the blood plasma treatment, we have been administering this treatment to about 39 people here in the country as well. And we are also revealed our plan for the antibody survey, and with the inoculation being rolled out here in South Korea, as for those who have already been vaccinated, we will be carrying out the antibody ratings for those who have been vaccinated. And also, we have the 5 types of vaccines which will be rolled out or which have already been rolled out here in South Korea, and we will be carrying out in-depth analysis of the development of the antibodies. And here are some aspects for the global cooperation with the as for our R&D. And on the 25th, in relation to the mRNA vaccines, we have been cooperating with the Moderna of the US, and we have been carrying out a virtual meeting with them. And through this meeting, we have discussed ways to cooperate for the means of developing the vaccines. And we also have seen some analysis and response of the Moderna's vaccines against the South African variant. And moreover, next Wednesday, which is the 3rd of March, we will also be having a similar virtual meeting with the United States National Center for Allergic Diseases, and we will also cooperate with them with the cooperation on the vaccine development as well. And as for the mRNA vaccine development technology here in South Korea, we still have much room for improvement. However, we will be supporting this area, and we will also enable the domestic development of these technology going forward. And as for the pan-government support committee on these vaccines, we have also discussed the factors of technology that are needed to develop such an mRNA vaccines here in South Korea. And going forward, we will also be having a business consortium to develop these mRNA vaccines also here in the country. And also, we have a separate subcommittee on the mRNA vaccine so that we can have a trilateral cooperation between the government and the private sector as well as the academia going forward. And as for the COVID-19 outbreak, we have seen on the 22nd of February, we have seen the Brazil variant, and we have been cultivating this variant here in South Korea. Starting from the 17th of March, we will carry out these analyses going forward. And as for these variants, just as we did with those stemming from the UK and South African variants, we will be looking at the efficacy rates of these vaccines against the Brazilian variant as well. And here are some updates on our inoculation. As of 27th midnight, we have administered the drug to a total of 18,489 people, and they have been administered with the AstraZeneca's vaccine, the first dose. And we have been giving them out to the nursing hospitals, about 12,000 people at the nursing hospital, and about 4,000 people at the nursing homes and long-term care centers as well. And as for some suspected adverse responses, we had a total of 15. However, all of them we see that they are normal or frequent adverse responses of vaccines, and they were very light symptoms like headaches and nausea and fever, so forth. And we have rolled out our vaccine here in South Korea before we reach spring. And we believe that individual recipients here in South Korea, we believe that every one of them are number one recipients of the vaccines here in South Korea. We would like to note that the vaccination rollout is the beginning step of overcoming the COVID-19 here in South Korea, and it is a very crucial step. However, you need to also continue to comply with the social distancing measures and the quarantine measures even after the inoculation, so that we can also combat the COVID-19 very easily and quickly. And as for the AstraZeneca and Pfizer vaccines, we would like to note that these vaccines have already been administered to thousands or hundreds of people overseas, and their efficacy as well as safety have already been confirmed and verified. So we ask you to understand these areas and also have confidence in the government's as well as our health experts' announcements, and please also participate in the inoculation drive that is being unfolded here in South Korea. Moreover, we believe that the effects of the vaccines can only be yielded after a considerable amount of time. So please be aware of this as well. As we near the end of this year, we will have a higher rate of herd immunity. And until then, please comply strictly with these quarantine measures to ensure the safety of yourself and that of the society. And simultaneously, after this weekend, we will be having a new school year for our schoolers here in the country. And still, we are not yet at a moment of compliance, at a rate or at a moment that we can let our guards down yet, but we ask for you to continue to comply with these measures, especially if you are parents or children or faculty members, and always report your health conditions utilizing the application. And if you have any symptoms, please do not go to school but get tested as soon as possible. Last but not least, please wear your face mask at all times at schools, and also minimize unnecessary movement as well, and also ventilate and disinfect your areas as well. And going forward, we are also very much concerned about the possible infection spreading through university campuses, as we believe that more people will be moving around the campus, especially at the dormitories, lecture rooms, as well as cafeterias. So we ask you to continue to comply stringently with these quarantine measures. Moreover, as for the face-to-face oriental meetings or any kind of other gatherings, we ask you to also refrain from having such private and social gatherings. We are also going to exert our full efforts to enable a quick and swift return to a state of normalcy, and we will also exert our full efforts to this end. Thank you very much.
질의응답에 앞서서 출입기자단에서 질문했던
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.